Welcome to our show, Ask Your Doctor. I'm your host, Shivani Raj. For today's show, we have Dr. Damodhar Garu, who is an MD in internal medicine. So, without any further delay, let us welcome Damodhar Garu onto our show. Doctor, welcome back. How are you?
Thank you, Andy. As always, glad to be back, and I hope you're all doing good.
Heart blocks in general are pretty common nowadays, and I don't think so. A lot of doctors actually talk about it, but I think I'm very glad that wanted to speak about what exactly heart blocks are. So, can we get on to the topic?
Very important topic, Andy, because I think we are coming to the end of the cardiac emergencies. So to continue with the sudden cardiac death, heart blocks are also one of the important things. Like last week we discussed about ventricular fibrillation and ventricular tachycardia. Normally our heart is you know, beats regularly, like lub, dub, right? So that's called normal sinus rhythm. Okay. So usually the heart beats, around 60 to 80 per minute, right? So that's a normal, and when the heart beats more than 100, it's called sinus tachycardia. Okay. And then when heart beats less than 60, it's called sinus bradycardia. Okay. So in between 60 to 100 is okay, right? And God has made the heart in a such way that it has to work all along. Like it cannot take rest. When it takes rest, we are done, right? So the electricity, there is a system called there's a sinus node which is in the left atrium, and then is a it connects to the other node in the right atrium. It's called AV node. And then there is a Purkinje system where, it goes into the muscle layer. So the current generates in the sinoatrial node, you know, and then it goes to the second node, and from there it goes to the, Purkinje fibers, and then it continuously keep pumping. Okay. So when the, when the heart has issues like, it could be either ischemia, like we discussed, because of the heart attack or because of other chemicals, and sometimes it's idiopathic. Young people can go into like sudden heart rate of like 160, 170, and they come to the ER. It's called supraventricular tachycardia. So there are tachycardias above ventricle, we call supraventricular tachycardia, and some, ventricular tachycardias where the origination happens in the ventricles, right? So it's like exactly like a current system, and you know. So it has to coordinate. The heart has to beat regularly. So lub dub, lub dub, lub dub. So basically, it has to function continuously. And when the system is interrupted, then they go into heart blocks. So there are three blocks: first degree heart block, second degree heart block, and complete heart block. So the first degree heart block is just a prolongation of PR interval. There is a P wave, QRS wave, and S wave and T wave, which is I don't think general people have to kind of go into those details, right? So when interruption happens, the interval gets prolonged. It's called first degree heart block, which is okay. It's not danger. Then when you go to the second degree heart block, there is called Mobitz type 1 block and Mobitz type 2 block. So when the Mobitz type 2 block happens, then obviously it's not a very serious situation right away, but they need to get a pacemaker. So it's one of the indications for permanent pacemaker placement. Then it's an emergency, like they have to get them temporary pacing immediately and then take to OR and get a permanent pacemaker. Otherwise, the heart is like the atrium is contracting at one rate and ventricular is contracting at another rate, so it's not lubbed up. It's like lub, dub, 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 lub, dub. So it goes like so. It's then it interrupts with the with to push the blood forward. You have to have a rhythm, right? You know. So when the top part of the heart is pumping and the other part is not pumping, and so it's kind of difficult to kind of meet the requirements of the body. So that's one thing. And young people may have initially little sensitivity untadi vallaki, but anybody who has a complete heart block is abnormal. So they need a permanent pacemaker. Sick sinus syndrome means sometimes their heart goes slow, right? Sometimes their heart can go like 150, 160. So it can vary, like go up and down, up and down. So those people also they need a permanent pacemaker. So when you put a permanent pacemaker, it automatically synchronizes, and takes care of it. So that's brief description about the heart blocks. But the most important arrhythmia we need to discuss today is atrial fibrillation, which is a very common topic and very kind of important topic also to prevent, especially stroke. Atrial fibrillation is one of the మనం డిస్కస్ చేసినాం కదా ఎందుకు క్లాట్స్ ఫామ్ అవుతాయి అనేది. When the heart is pumping irregular, not only irregular, but irregular, that's called atrial fibrillation. సో అదేమవుతుందంటే అట్లా అయినప్పుడు లెఫ్ట్ ఏట్రియం లో చిన్న చిన్న క్లాట్స్ ఫామ్ అయ్యే ఛాన్స్ ఉంటుంది అన్నట్టు. సో దోస్ టైనీ we call embolic stroke. They can go into the brain and cause a big damage to the entire body. They can come with paralysis. If it affects the left side of the circulation, middle cerebral artery, they can come with right-sided complete paralysis. And if it goes to the right side, they will develop left side hemiplegia. So that is a very preventable cause of morbidity and mortality. ఎందుకంటే atrial fibrillation can happen in the sleep also. So once we can diagnose that, we can treat them with blood thinners, and there is a lot of new stuff I can explain now.
My first question is when people talk about pacemakers, they generally say that someone is dying or they had a heart attack. So how different is a heart block and a heart attack in general? Like, this is a very basic question, but that is my first question. Is heart attack and heart block completely different? Because like the same way how brain stroke and brain clots are different.
Heart block is can be a complication of heart attack. Who has a heart attack can go into heart block, right? But heart block can happen without heart attack also, right? So they both it's a complication of heart attack. It is one of the complications, but heart blocks can happen without a heart attack too, because it's about the not the circulation issue. It's about the current, electricity part, And when there is disruption at the, like I said, SA node and AV node, these are the two nodes. One node is in the left, top of the heart, right atrium, and one node is in the bottom of the heart. So the fibers connect to that, and then the AV node connects to the Purkinje fibers, which goes into the muscle, and so they constantly, kind of continue to generate that stimulus where the heart can synchronize and pump continuously. Okay, so this can be interrupted because of the మీరు అన్నట్టు heart attack తో interrupt కావచ్చు. ఎందుకంటే when there is certain area like infarcted, that means that area is power supply is cut అనుకోండి. So it can happen in a heart attack. So again, the treatment is the same. Like if they are in complete heart block, they need to get intervention. And a lot of times sick sinus syndrome is in old people. We discuss they need pacemaker also.
When people talk about these regular heartbeats, I think it also some people. So can we consider that as a risk for cry for help from the heart, or is it saying that listen, something is wrong with it, and then an immediate test must be done? So what are some tests which are related to hearts that people can get it done quickly to make sure that their heart health is fine?
So when it happens in sleep, the patient may not know, right? And it may go back to the regular rhythm in the morning. But if they are unfortunate, they may develop stroke in the sleep, Andy. You see what I mean? So when they develop the stroke in the sleep and they go to hospital, then their monitor, the EKG part, is the primary, test where it can diagnose the, atrial fibrillation. But క్లినికల్ గా కూడా డయాగ్నోస్ చేయొచ్చు. మనం ఇప్పుడు పల్స్, శివాని గారు మీ పల్స్ చెక్ చేసుకోండి. యూజువల్లీ యూ విల్ ఎనీబడి కెన్, ఇఫ్ యూ స్టార్ట్ చెకింగ్ యువర్ పల్స్, ఇట్స్ బీటింగ్ every certain interval regularly. Let's say suppose after a few beats it didn't beat, and then again it beats, but again it goes stopping in between. So it's like irregular phenomenon. So it's a clinical diagnosis as well as EKG is confirmatory. You do a EKG and you can diagnose it. The heart is going irregular. See what I mean? So that's the easy way to diagnose is atrial fibrillation. But unfortunately, this condition it's a little different from other conditions. Like people can go in and out of atrial fibrillation. See what I mean? They may go into atrial fibrillation and then they come back to sinus rhythm. So if it happens in the sleep, they don't know. See what I mean? But when it happens during daytime, they will feel real palpitations, trouble breathing, and like they may collapse. So their heart rate will sometimes go up to 180, 190, and then immediately they will go to the emergency department and the EKG confirms it, and they are treated with intravenous drips. Usually here we start with in the olden days they used to use digoxin, but now the drug of choice is cardizem. They put first they give a bolus IV injection, and if the patient doesn't respond, they will admit and put them on the continuous cardizem drip, which controls the heart rate. And then we'll discuss the important part of management.
When you have a heart blockage, so does the symptoms of heart blockage and heart attack, are they similar, or can we find any difference so that the patients can rush to the hospital as immediately as possible?
Symptoms, if the reason for heart block is because of the heart attack, then the symptoms are the same, like chest pain, radiating to the left arm, తర్వాత వాళ్ళకి స్వెట్టింగ్ ఉంటుంది, తర్వాత దే విల్ హ్యావ్ నాజియా ఉంటుంది, వామిటింగ్ ఉంటుంది. సో I mean, like they have, sometimes they can have difficulty breathing. But if it is not related to heart attack, they may start having syncope అంటామండి. Syncope అంటే they may collapse. Transient, they may become unresponsive transiently, or they may start feeling the heart like దడ అంటారు కదా, లైక్ ఇట్లా అవుతుంది, ఎట్లా సార్ ఇట్లా హార్ట్ కొట్టుకుంటుంది, తెలిసిపోతుంది మాకు అంటారు, పాల్పిటేషన్స్ అంటారు. సో అవి కూడా కావచ్చు. అప్పుడప్పుడు ఏమవుతుందంటే when the blood pressure drops, they can just become dizzy and they may collapse. So basically, if it is related to heart attack, you get the heart attack symptoms. If it is not related to heart attacks, because heart blocks can happen without heart attack too.
Indian myths that people just say, they'll be like, oh, if you have a heart block, oh, it's fine, you can clear it naturally, have this food, that food, this fruit. I mean, of course there is prevention, but is there any natural cure for these kind of heart blockages?
People have beliefs, and sometimes some people may be lucky because these heart blocks, unless it is complete heart block, you don't need a immediate complete heart block and Morbid's type 2 heart block. You don't need an immediate urgent intervention. You see what I mean? So some people, maybe they will have, type 2, Morbid's type 1, and which may not require intervention. And, they go to this, Ayurvedic, homeopathy, and they may feel better. But in my opinion, I think it's risky, Andy. I think we don't have the data, we don't have any, research, and we don't have any, proofs that their medicine are working. I mean, like, a lot of times it's the belief and, Sometimes people may get scared and start taking care of themselves, and that may be the reason. But I don't think I don't have anything against other type of medicine. I respect because it's all originated from from our a lot of things transformed, and I'm sure they have their systems and reasons how they treat, right? So, but my advice is, I think you can try. There is nothing wrong, but you should always be careful and do you know what you have to do and how much comfortable you are, because tomorrow you don't want to blame somebody else. Oh, that doctor said, this will work, and so I think you have to. There is a lot of information, and I think
Yes.
everybody has to decide, according to their situation.
And also, Damodar Garu, I wanted to ask, are there any specific people that are prone to these kind of heart blocks? I mean, if they have a history of family, because, I don't know correctly that is if heart attack is hereditary, but again, is anyway thyroidism or, athletes who are continuously, putting pressure on their hearts, are they easily prone to it, or does heart blocks happen to absolutely everybody?
Yeah, there's various reasons why things can happen, and there's a lot of systemic reasons. But thyroid can cause neuronitis, thyrotoxicosis can cause irregular heartbeat, and once you treat, so when somebody comes with atrial fibrillation, you have to do a thorough workup. You know, the first thing is diagnosis confirmation, and second thing is you look for other causes other than heart, right? Like thyroid and other reasons. But most commonly, it's related to hypertension and long-standing hypertension and coronary, artery disease, and alcohol also can cause atrial fibrillation, and of course medications. And so basically, the most worrisome with this thing is it can cause stroke, right? So basically, a lot of people go in and out of it, right? So what we have to do here is first thing is confirm the diagnosis and then do the echocardiogram plays a very important role here. So echocardiogram, whether they're having any LV dysfunction or any valvular heart disease. Like you can, there's so many blood thinners. In the past, they used to do warfarin or Coumadin. Even in India, still they use Coumadin, and they follow INR. But the newer anticoagulation, like I, discussed in the previous sessions, are very effective, and they don't need to have blood monitoring like daily, weekly, monthly. So it's a safe and easy way. They're a little expensive, but I think that's a way to go. There is Eliquis, there is Apixaban, and there's several other newer anticoagulation, oral anticoagulation medications. And of course, cardism, once the heart rate is controlled, you can switch it to, once a day cardism. Initially, we can do 3 times a day, and then we can do long acting once a day cardism. And amiodarone is pretty good if cardism doesn't work. So there's a lot of things. But the most important thing, Sunday Shivani Garu, and now, the cardiologists, like they have several newer things where they can do a procedure called Watchman procedure. So wherein they can go and seal that you know appendage they call, like so it's like they don't even have to open. They can do while doing like a catheter angiogram. So they can go and do that, and that actually helps, proven to be very helpful. And most of the American hospitals are now training the cardiologist and equipped to do that Watchman procedure under it. You just seal that, and then the risk of embolic stroke is significantly less. And of course, valvular heart diseases గురించి కూడా మనం లిటిల్ డిస్కస్ చేయాలి, ఎందుకంటే దీనిలో మైటల్ స్టెనోసిస్, మైటల్ రిగాజిటేషన్ మనం డిస్కస్ చేసినాము. Aortic stenosis is another important topic, and where a lot of new things have happened. So aortic stenosis వల్ల కూడా people especially as you grow older, some people can develop regurgitation, some people can develop stenosis. సో ఈ స్టినోసిస్ కూడా ఇప్పుడు న్యూరో ఇంటర్వెన్షన్ వచ్చింది. ఇంతకుముందు అంటే ఓపెన్ హార్ట్ సర్జరీ చేసి వాల్వ్ రిప్లేస్ చేయాల్సి వచ్చింది. బట్ ఇప్పుడు కొత్తది టావర్ అని వచ్చింది, TAVR, టావర్. Travel is just daytime, maybe sometimes they may have to stay a day, but they can go and do it like a cat. And a lot of hospitals, so my friends, they are well trained. They do, this procedure. They can replace the valve without opening the, chest. It's called TAVR. So that's a very good development recently. So for aortic stenosis.
Doctor, when I speak to different people, unfortunately there are a lot of people with pacemakers, and you see nowadays pacemaker has become like not, before 10 years it was like, oh my god, he has a pacemaker, but now it's like, oh, it's just like another thing that is happening. So how it is for people who are living with a pacemaker or who are having a heart block, do they have to take any special treatments or special care, especially for themselves, so that this their condition is not severe later?
Like any other condition, they need to get the battery checked, and the pacemaker battery. But if they follow with their cardiologist, they'll take care of it. Like they'll interrogation under pacemaker interrogation. I think they will do periodically according to their schedule, and that's important thing, because ఇప్పుడు లోపల మిషన్ నుండి బ్యాటరీ లేకపోతే బెస్ట్ గా. సో దట్స్ ఇంపార్టెంట్ థింగ్. సో దే హ్యావ్ టు ఫాలో విత్ ద డాక్టర్, బట్ ఇట్స్ they won't feel it actually. Once it heals under the skin, they don't feel it. It's not visible to anybody, and it's not any cosmetic issue, because it's once the stitches are healed, you won't know that he has a pacemaker. You can't identify unless you feel it, unless the doctor examines, but it's not a problem for them. Nobody can know that they are having pacemaker. You see what I mean? So it's not a problem. But like again, for all these arrhythmias and even for the atrial fibrillation, we got to take care of the cause. Like atrial fibrillation, there is a score, like I said, chart score. If the score is not bad, they may not need anticoagulation. So they have to follow those precautions. And definitely cardiologist follow-up is very essential and important, because once you reach that stage, you got to follow up with them.
So I have read this article, how initially before people used to say only men are prone to heart attacks and more prone to heart attacks. And then I recently, like probably like a couple of days ago, I read another article where they said that heart attacks don't discriminate. It is pretty similar to both of it. But what do you think? Like, are men more prone to heart attacks and are women not? Because honestly, even I genuinely saw most men having heart attacks, and I've hardly seen women who got a heart attack. So, what is your take on this?
You're right. I think women until menopause, they have a little protection because of the hormonal regulation. But after menopause, I think that cover is pretty much gone. So that's why women after 50, the risk is pretty much equal to men and women. So nature is the most powerful. Actually, women are the powerful people, but unfortunately, people say they are the weaker sex. You know what I mean? But actually, naturally, women are stronger, in my opinion. Because they give birth to babies. So I think the menopause is the key. Like I think estrogen protects until then. That's why after menopause they need to start taking supplements. Otherwise, they'll have a lot of. They can drive men crazy then.
Generally, it's also for the men who's looking
Of
after
course,
it.
yeah.
And it is very. And it is very funny that they only say 15 days, but they don't understand the whole cycle. Like, even if they last for 5 days, it happens from 10 days before. Like, all of it. The craving,
Right, right.
the
Still,
hormonal
it's
imbalance.
yeah, we're going into a different topic, but it's premenstrual
Yeah.
syndrome, and some of them can go into depression, and they may need antidepressants.
So heart attacks are not discriminating anybody, is what you're
Uh,
trying to.
until menopause, I think until women reach to 50, they have a little less incidence of heart attacks compared to men. If the woman has diabetes and family history, and she keeps smoking like a chimney, and and eating all the junk food, then that person is not going to help that. You know what I mean? Because in America, we see a lot of these folks. They don't have insurance, but they will be smoking like $10 cigarette pack. Well, so $10, like you can. I mean, like in a week, if you're smoking like that's $70, you can buy insurance. So same thing with drinking, like social problem, but. Like I say, everything, you have to, be aware of your, you know, health, and also you have to learn, because there everything in the, media now, resources are there, but you got to use it for your benefit.
I think it was a very informative episode today. Thank you again, Andy, for tuning in. It is very lovely again to have you on our show. Thank you for the viewers for tuning in. You're watching Sakshi TV with me, Shivani Raj.